Hi, I'm Madison Cornell, and I'm presenting my senior research capstone project that I did with Hispanic Health Initiatives on nutritional education. So before I start with my capstone project, I'm going to give you a little background about me. I am not 100% sure what I want to do with my degree yet, but I did transfer to Stetson as a sophomore, and I came to the school as a health science major because I was really interested in nutrition, dietetics, psychology, and human anatomy. I've always been really interested in nutrition, and when I was younger I was a dancer, and when I graduated I started running, so I've always been really interested in living a healthy lifestyle. So that was some of the reason why I did pick this capstone project to do. Like I said, I was a dancer, so I was very active when I was younger, and I continued being active once I went to college, and I got really focused on what I was eating and how I can eat healthier, especially because college food sometimes isn't the healthiest. And I've always been really interested in nutrition and dietetics, especially when I took my classes at Stetson. So some of the preparation I did for this capstone was some prior classes that I did take during my time at Stetson, and those classes were health psychology, intro to nutrition, and health and wellness. I think having prior knowledge from these classes really did help me develop my senior research project, and it really helped me put the knowledge that I learned from those classes into this project. So my intro to nutrition class really helped because we learned about all the different food groups, what food groups are healthier, and how much you should be eating of those food groups. And we talked about which foods were better to eat in the morning and at night, and that there's some people's bodies are better with certain foods, so we learned a lot about that and talked about that. And we also learned about how to read a food label correctly, how to decipher which terms to look out for, which was a really essential part of my project and really helped me with my knowledge to teach Hispanic Health Initiatives, because there are a lot of terms that can be confusing to some people if they don't know how to read a food label. So that really helped learning in my Intro to Nutrition class in Stetson, so I was able to portray that in my project. And for health and wellness, we talked about how your overall health can affect your well-being, meaning it can affect your mental status and like how you feel occupationally, how you feel physically, how you feel socially. So it can affect how you work in school and how you portray yourself at work, and it can affect you spiritually. It can affect your social life with your friends and family. So we learned that when you have one of them that is off balance, they do tend to affect the rest of your life. And I do think that this does apply with healthy eating and maintaining a healthy eating diet. So I think that helped a lot with sharing how important it is to have a healthy lifestyle, because it can affect other parts of your life, and it is really a cycle of health and wellness. In health psychology, we learned about how certain people prefer to adhere to doctor recommendations, and how certain groups of people will adhere to doctor's advice and they won't. We learned about how men are more likely to not see a doctor because they don't think they have to. Women will see a doctor because they will be more stressed out about their symptoms. So stuff like that, where we learned about statistics on how people adhere to medical and nutritional knowledge from medical professionals, and that low-income cities and countries will live an unhealthier diet and an unhealthier lifestyle, and because they are low-income, they aren't able to always see a medical professional. So it does go back to the cycle of low-income, it can have an unhealthier lifestyle because they aren't receiving the medical help that they do need. Okay, so the organization that I worked with for my senior project was Hispanic Health Initiatives. It is a nonprofit organization outside of DeBary, Florida, and it's an amazing organization. It's all a lot of volunteers will come and they'll do nutrition fairs, they'll teach educational classes on diabetes, on cancer, on nutrition, and they will come and they will teach people that do not have access to medical health care and that need the access to, taking their vitals, and they need to be pushed a little bit to help live them a healthier lifestyle. And a lot of these people are from low-income places. Some of them aren't. Some of them just don't have insurance and they can't afford, out-of-pocket healthcare. So Hispanic Health Initiatives does help that. No one at Hispanic Health Initiatives is a physician or a clinician, so they can't diagnose or treat anyone, but they can take their vitals and they can, recommend like, hey, you should go to the doctors. You could potentially be pre-diabetic, or you could potentially be pre-hypertensive and at risk of high blood pressure. So they will also give them pamphlets and brochures, and they'll hopefully give them my project to help them live a healthier lifestyle and recommend them to go to the doctor to seek out help so they don't end up with a worse or worsening disease or condition. So my capstone project was to create a low sodium meal plan for the community that Hispanic Health Initiatives does help. They are going to have it in their nutritional education class, and the reason why Pete, my supervisor, really wanted me to do a low sodium meal plan is because they've been having a lot of trouble with high blood pressure, hypertension, pre-hypertension. So they've had a lot of problems, I guess, with people that they've been seeing at their healthcare and their nutrition education class being at risk or having high blood pressure. So he said this is something that they're really focusing on as an organization. So I was happy to help them with that. And he also said that to teach people how to properly read food labels and how important it is for you to decipher which foods are healthy for you and which foods aren't, and to show that there are terms such as fat-free, no sugar added, that doesn't mean that they are healthy for you. So there's certain terms that he wants the people in his organization and community to look out for to help make healthier choices. And all of this was to help prevent high blood pressure at the end of the day. If they know how to read food labels better, then they'll know which foods are lower in sodium, and then they'll create their own meal plan on that, because sometimes you'll set a food plan, but people will be able to go and eat whatever foods they like as long as they know that this food is within the amount of sodium that I should be eating. So some of the research that I did find on this, a lot of it was people asking, how do I live a low sodium diet when I go out to eat, which was very difficult for some people. Mayo Clinic and Cleveland Clinic both did research on this as well, and they said that they think when people go out to eat, obviously it is the most difficult. It's a lot harder to track which ingredients you're putting in the food that you eat like you do at home. So they recommended when ordering sides, always try to order vegetables. Try to order steamed vegetables or broiled things, because it helps with low sodium. In that, to avoid bread, because a lot of the bread in restaurants is salted or they have a lot of sodium in them. And they also said when ordering meats to get them grilled or broiled, to try to completely avoid fried and breaded meats because of the sodium in them. Some of the recommendations that they did have for when at home was when you are seasoning your meat to use more fresh herbs and ingredients like lemons and limes and thyme and rosemary, to try to use the seasoning without using seasoning salt. And then when you are at home, also to add which sodium that you need to for the recipe, and then completely eliminate the sodium and the salt shaker from your table. So it eliminates from yourself and people from your family to add a continuous amount of salt. When you do a recipe, you know exactly how much is being put in there. When you were putting it on with a salt shaker, it's very difficult to measure exactly how much sodium you are putting. So some of the challenges I did face, the first challenge was when I first started my senior research project. I was unsure which meal plan I was going to do. I wasn't sure if my supervisor wanted a gluten-free meal plan, vegan, vegetarian, or just an all-across healthy meal plan in general. So I did struggle with what foods do some people like, what foods do some people not like. And that will always be a struggle when coming up with a meal plan, and that's why people should be able and will hopefully be able to read food labels so they can replace the foods that they don't like with foods that they do like and have around the same sodium content and just nutritional content in general. But I did reach out to Pete, my supervisor, and I said, hey, is there a certain meal plan that you want me to follow? Is there anything specific that you want me to pinpoint? And that's when he told me, like, yes, we are focusing on low sodium to help prevent high blood pressure. So that challenge I did overcome early on in my project, luckily, and that was, I was able to pinpoint exactly what I should do for my project and exactly what the site and the organization wanted from me from this project. So my second challenge was producing a realistic meal plan, because when you go to some people that are low income or they are used to an unhealthy eating plan and you say, hey, we're not gonna have any bread anymore, they're gonna look at you like you're crazy. So you need to think of a realistic food plan that is actually going to help people and that they're going to adhere to, because if you cut out every single food that they enjoy, then they're just going to go back to the way they were eating before. So that was difficult for me, just like to find foods that are low in sodium and were healthier for you, but also not trying to completely eliminate the fun in eating for some people. And that was a challenge that you may never overcome, just because some people will adhere to whatever you tell them, because if they truly want to live a healthier lifestyle, they will try as much as they can to, and then some people just are going to fall off the healthy eating wagon regardless. So my third challenge was trying to find accessible and affordable food for people. Although not everyone a part of Hispanic Health Initiatives is low income, there are a lot of people that are low income or don't have insurance. The reason why they're going to Hispanic Health Initiatives is because they can't afford health care. So eating healthy foods can also be an expense. And that is a struggle for some families. It's even a struggle for some families not even having to do with money, that they have a lot of kids and they're a single mom or a single dad, and they come home late from work and they just don't have the time to always cook a fresh home-cooked meal for their family, so they'll throw in a frozen pizza. And processed foods and going out to eat is when you have the most sodium in your diet. You're not able to measure how much it is, and just with processed foods, there's an uncontrollable amount. And it is sometimes difficult when you have a large family or late at night, and not saying that no one is ever going to do that, because that's also unrealistic, but it is difficult for people to have accessibility to all these fresh ingredients. There are a lot of people that will go food shopping once a week, and when you go out and you buy fresh meats, fresh fish, fresh vegetables, fresh fruit, they might not last till the next time you go grocery shopping. So there are people that aren't able to go grocery shopping 2 times a week, or they're not able to afford fresh fish and fresh produce every week. So that was a big challenge. It's also like challenge 2. Some of those challenges you just will never overcome, because everyone is in a different place in their life financially and occupationally. Some people might not have the time, some people will. So that was a challenge I did want to consider while making the food plan. So I tried to make the food plan and a few alternatives with the food plan. So if people didn't have broccoli, then they could make something else for a side. I did learn a lot from the senior research project. I feel like it is very eye-opening to how many people do not have medical care insurance, and that many people, because of this, don't even know that they have a chronic illness or disease. And there are a lot of people that are pre-diabetic or already have diabetes or high blood pressure that don't even know it. They are living their life as they normally would, and they're diabetic, and they're just worsening their condition by not getting the treatment and not living a healthier lifestyle. So I didn't realize in doing this project that there are a lot of people like that, and that I learned from Hispanic Health Initiatives, if we were to educate people little by little, we could reduce the risk of all these diseases, and we could help with a healthier eating and healthier meal plans and just an overall healthier lifestyle for people that have these diseases and are low income. Okay, and then lastly, my experience overall with this site was amazing. Pete, my supervisor, was great. He was very accommodating to my schedule. Every time I would reach out to him, he would come back to me in a very timely manner, and anytime I had questions, he was happy to answer them. He really helped me pinpoint exactly what I should do with this project to help the organization and help me learn something as well. And I think what this organization does for the community is just outstanding. I wish that there was more nonprofit organizations that did help communities and gave back to their communities like this, because I truly do believe that if we had people not even just administering treatment and diagnosing, but just what they do, educating people is such a big thing. When people know the symptoms and know what they can do to fix it, then they can help fix or prevent a disease that could be starting and that they don't even know about it. So I would definitely, for future seniors at Stetson, I hope you guys keep this site, and I would definitely recommend it to the future students that are taking senior research. And that is it. I hope you guys really enjoyed my project. I truly did enjoy doing this project, and I had a lot of fun. Thank you.